A high red blood cell count means you have more than the usual number of these cells, which are made in your bone marrow and found in your blood. The main job of red blood cells is to carry oxygen from your lungs to the rest of your body. A high red blood cell count can happen because of a medical condition that causes low oxygen levels. Other medical conditions can also cause your body to make more red blood cells than it needs. Figuring out if your red blood cell count is high depends on the lab doing the blood test. In general, a normal range for adults is 4.55 to 5.65 million red blood cells per microliter of blood for men, and 3.92 to 5.13 million red blood cells per microliter of blood for women. For children, a high red blood cell count depends on their age and gender. Low oxygen levels, misuse of certain medications, and blood cancers can cause a high red blood cell count. Your body might make more red blood cells in response to conditions that lead to low oxygen levels. These conditions include adult congenital heart disease, COPD, heart failure, hemoglobinopathy, living at high altitudes, pulmonary fibrosis, and sleep apnea. These conditions can significantly increase red blood cell production. The effect of cancers and certain drugs on red blood cells. Cancers or precancerous conditions that affect bone marrow can cause some people to make too many red blood cells. Examples include polycythemia vera and misuse of performance-enhancing drugs. Some drugs boost red blood cell production, including anabolic steroids, blood doping, also known as blood transfusions, and injections of a protein known as erythropoietin. High red blood cell concentration. If the liquid part of your blood, known as plasma, is too low, it can seem like the number of red blood cells is increased, such as with dehydration. However, the red blood cells are simply packed more tightly, and their count is often not affected. Other causes of high red blood cells include dehydration and other diseases. In rare cases, the kidneys might make too much erythropoietin in some kidney cancers or after a kidney transplant, which leads to more red blood cell production. A high red blood cell count can also occur with non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease.